Daily cases in the country continue to hit new all-time highs with a recent surge in infections. To tell us how businesses are coping, we have Philippine Chamber of Commerce and Industry President George Barcelon. Good afternoon, Sir George. A lot of people are testing positive for COVID-19, others calling in sick with the flu. We might not know which they are indeed afflicted with, but how is the working condition in some of your member companies at the moment? How are they dealing with the shortage in staff or manpower?
Good afternoon, Sean, and to the televiewers. I think we expected the surge, no, because we can see that in December or the last quarter, we were more lax in the alert level, and there's more mobility, no, and the service sectors have been opened up. They're allowing more higher customers patronage. So we expected the numbers to be high because I'm not a medical expert, but I can see what's happening in other countries. Okay, and normally when you have time wherein people cannot avoid being close to each other, no, we know very well pag December all the hygiene protocol are thrown out the window.
Yes.
Hindi natin maiwasan yun eh. I mean that's the way. I mean they need to sort of have that as part of their holiday celebration. And if you look at the Changi, if you look at the Divisoria, wala. I mean, and it's we expected it. But the surge in numbers that we did not expect. That's so fast, no? The positivity rate was now ranging between 35 to 40%. So that caught us in a way surprised, and we were a bit concerned. But when we saw what other people are sharing with us, no, other countries, na it's mild naman eh. Okay, but I'm not saying not to do away with the hygiene protocol, no, not to be careful. But we realized that we have to have or the government and the private sector must collaborate, no, to have a better handle of this. First week of January, when the numbers are surging already, I called for a meeting, a courtesy call with Secretary Ramon Lopez, expressing to him our concern on this COVID surges. At the same time, sharing our thoughts that I think what's happening, numbers, infection is high, but the healthcare services are still capable of handling it. Hindi pa naman masyadong overwhelmed.
Yeah.
And the other factor that we were basing on was the mortality rate. Okay. Meron, di naman wala. We are saddened if there's any loss in lives, no? But the number is not as high. Okay, we are still overall still ranging between 1.65 to 1.7% on the mortality. So, having said that, we of course tell our members be careful. The testing may come too late. Okay. And this is exactly what had happened. Many companies that allow their workers or their staff to come to the office and test them regularly, all of a sudden they're finding about 30% nahawa na.
Yeah.
Okay. But the people, wala naman symptoms eh. Except for a few, it's very flu-like, no? Sipon, headache, fever. So from what I've gathered, no, is many cases, I'm not saying all, I'm sure there are some cases that became more serious. But a lot of cases, you must 4 to 5 days na recover, no? So this is where we are. We are very, in a way, taking a very cautious approach, no? Since it's January, when I was asked how I take it, I said, look, I'm a businessman, and normally businessmen are more of the optimistic type. We want things to work out well, not so optimistic. But with what's happening, we are what I will describe as guarded optimism.
Okay.
May optimism
so
is guarded.
Yeah, you were saying, sir, that there is guarded optimism and that the cycle, as of course, anecdotally, based on your observations and what people have told you so far, that it seems to be a shorter cycle of getting infected, getting the symptoms, and then getting better. Now, we also have the IATF already lowering the quarantine requirement for fully vaccinated health workers with no symptoms down to, I believe it is 10 days rather, or 5 days.
Right.
Are businesses thinking of calling for the same relaxed protocol? Because you also mentioned it's about 4 to 5 days before the
Well,
employees report
yes.
to feel
It's
better.
not that we're calling, but it's just a question that we're what we're seeing on the ground. No, wherein people, yes, they were tested positive. They felt a bit like flu-like symptoms. So we asked them to stay at home.
Okay.
Okay. And then usually, as I mentioned earlier, mga 5 days then they would report that they're okay. Okay.
Okay.
They self-quarantined at home, but we still require them to stay the full cycle
Okay.
of at least some 10 days, some 14 days.
Okay. So 10 to 14 days per end.
Yeah,
You
we
also
still do that.
mentioned, yeah. You also mentioned before that you support companies shouldering the testing expenses for their workers. Is this more or less still what's happening on the ground, despite what the DOLE said about, having the employees shoulder test expenses? Are a lot of employers that you know of still extending a hand to have their workers tested or shouldering expenses for testing?
I believe so. The reason why is, if you don't have enough business, no, you don't need the workers, then you won't be calling them, whether they're vaccinated or not, di ba? If you
Mhm.
don't have enough business, but it's only when you have enough business, then you need the workers. Of course, some are not vaccinated for whatever reason. I would not be judgmental on that, no, for whatever reason, comorbidity or whatnot, no. But what I'm seeing is a lot of companies will test them, will test the workers, and shoulder the expense. Actually, this testing dapat ang sasagot diyan sa gastos is the government.
Mhm.
The government should shoulder that. But nevertheless, let's be realistic. No, to wait for the government might take forever. So the private sector has really, done their work. No, we know that it's at this critical point in time. Ayaw naman namin na pagastos yung testing kasi mahal eh. Okay,
Mhm.
it's something between 1.5 to 2,000. What we in our company or many of the companies, they provide the rapid antigen test,
Mhm.
which is faster to detect, and it's quite accurate. I'm not saying it's 100%, no, but we that's what we do.
All right. What about this possible shift to alert level 4 that everyone is talking about? What is the opinion, or what is the, or how should I say, the sentiment of the business community on this possible shift to alert level 4? Are they largely in favor of that?
Well, the alert level 4 again requires whether there are some parameters that are breached. Okay, all of this. Remember, all of this lockdown. The rationale behind the lockdown is to flatten the curve, di ba? Ang ibig sabihin, hindi na overwhelm yung hospital, yung healthcare. The usage of the hospital is still below 50% in many of the hospitals. Of course, I've heard some hospital, no, na umaabot ng 100%. There's also this fear coming from media about this new Micron, no? Omicron, and then they're afraid of it. So may mga iba, when they've tested positive, takbo sila kagad sa hospital. But it's still up to now, the percentage of hospitalization is still, capacity in hospital is still low. It's still below 50. Some are even 40. So we would use that as a guide. And I think DOH and IATF, no, they're both consciously monitoring that. If it's maintained at that rate, although the infection is high, then the alert level can be maintained as it is right now. No? And there's a
Yeah.
semblance of what you call normalcy in the economic activity.
All
we
right.
don't want, yeah, we don't want, last December, the unemployment rate actually went down because of the, level two, there are more restaurants are open, malls and everything, and workers are asked to come back to work. Okay. Because, sometimes what we see is, the stores, the restaurants, but you have to think about the supply chain. Okay. So we're crossing our fingers, no? As I said, guarded optimism that this will not go up to alert four. And even if it were alert four, I would like to think that it's going to be on a granular basis. Okay, granularity on the local government.
All right. On that note, thank you so much, as usual, for your time and for your insights. PCCI President George Barcelon, thanks for joining us this afternoon.
Thank you, Sean. Yeah.